Have you ever wondered how doctors can look inside your body to understand if something like tuberculosis might be present? Medical imaging, specifically a chest X-ray, is a vital tool that gives healthcare professionals a picture of your lungs and surrounding areas. It helps them identify important clues about your health. A chest X-ray can reveal several key signs that suggest the presence of tuberculosis, or TB, especially active TB disease. The most common findings include infiltrates, which look like cloudy areas, and cavities, which are visible as hollow spaces in the lungs. You might also see enlarged lymph nodes in the chest or signs of fluid accumulation. These visual cues on the X-ray are often the first strong indicators that TB might be active. These signs appear on an X-ray because the Mycobacterium tuberculosis bacteria, which cause TB, trigger a specific immune response in the lungs. When the body fights the infection, it creates inflammation and tissue damage. Infiltrates are essentially areas where inflammatory cells and fluid have gathered. Cavities from when the disease progresses, destroying lung tissue and leaving open spaces that the bacteria can multiply in. Over time, the body might try to contain the infection, leading to scarring or calcification, which also show up distinctly on an X-ray film. For you, this means that if your doctor suspects TB based on your symptoms, a chest X-ray will likely be one of the first diagnostic steps. The radiologist, a doctor who specializes in reading X-rays, will carefully examine the images for any of these characteristic changes. If signs of TB are found, it does not confirm the diagnosis on its own. Instead, it indicates the need for further testing, such as sputum tests to find the bacteria and confirm active disease, or additional imaging to provide a complete picture. It is fascinating to know that doctors look for specific patterns that tell a story. For example, a Ghon complex or primary complex is a calcified lesion and an enlarged lymph node, indicating an old, healed infection. Another telling sign is a miliary pattern, which looks like tiny scattered spots across both lungs, similar to millet seeds. This pattern suggests a severe form of TB where the bacteria have spread widely through the bloodstream. Recognizing these specific patterns helps doctors understand the stage and severity of the TB infection. Ultimately, the ability of a chest X-ray to pinpoint these distinctive changes in the lungs is incredibly valuable. It helps doctors quickly identify potential TB cases, guiding them toward the right follow-up tests and ensuring you can get effective treatment as soon as possible. This early detection is crucial for managing the disease, protecting your health, and preventing its spread to others.